So in the mouth, pain is often a late finding. When you develop a small cavity, it doesn't bother you until the cavity starts growing more and more deeper into the tooth, and then the nerve is involved, and that often calls for root canals. So, someone coming into my office asking about the reasons for wisdom tooth removal, we actually have a really in-depth discussion about that. But I would say that half of the patients we see, we actually are taking them out due to pain or symptoms, and the other half, it's a discussion about why preventative removal might benefit them more from watching and waiting over time. So the way I prepare for wisdom teeth removal really is comes with the preparation and planning. So that starts with our state-of-the-art cone beam machine and making sure we have all the information we need in terms of where the tooth is, how it's oriented, the teeth's the tooth proximity to the nerves and sinuses, adjacent things like other teeth and other bone in the area. So that's how we primarily prepare for wisdom teeth removal, is kind of coming in with a plan beforehand. Here at the office, we only use really state-of-the-art technology and equipment. So, all of the instruments and equipment we need for removal really make the surgery, quite straightforward for me, and also which equates to a much more straightforward recovery for the patient. What I tell patients who are nervous or anxious about wisdom tooth removal is that um, the good thing is that what we offer here with sedation is that you don't have to hear, see, or remember any of the surgery. So that's thing number one. Thing number two is really preparing patients for their postoperative recovery, which is again just very, very mild swelling in the cheeks, if any, and 1 week of having a soft diet, including things like ice cream and mashed potatoes. So those are what I reassure patients in terms of how the procedure goes, which for most people they have no recollection, and the other side of in terms of having just a straightforward and easygoing week afterward. As an oral and maxillofacial surgeon, I offer the full spectrum of anesthesia options for oral surgery in my office. So I received years of training that have really given me the experience and background to offer sedation and different types of sedation for different folks and for different folks and different surgeries. So for me, the 17-year-old, really my goal is to do a really safe procedure and safe sedation, regardless of the situations. But pretty common procedure we do here that obviously requires thinking and preparation for it beforehand. But for the more medically complex patients, again, it's a discussion about what their medical conditions are like and where they're at with them and what the trajectory of some of these conditions may be. And from there, tailoring the right type of sedation. Or recommendation to come and get an anesthesiologist with us. These are all things that I think about really critically when I work up a case for oral surgery with sedation. Healing after wisdom tooth removal takes about 3 to 4 days before patients start to feel noticeably better day by day. We offer patients a comprehensive list of instructions after surgery to make sure that the recovery does go very smooth. We've really tailored that to make sure that we optimize everything in terms of hygiene, diet, medication use, that really should get you back to normal as soon as possible. Unfortunately, I do not know if pineapple juice is the solution to all swelling after oral surgery procedures. That is to be determined. So after oral surgery procedures and wisdom tooth removal, I will counsel patients to remain on a soft diet for 1 week. Well, what does a soft diet mean? A soft diet means anything that you eat that can easily be rinsed out by drinking a glass of water or doing the rinsing that we recommend. Um, for foods that get stuck in between teeth and require a lot of flossing and brushing to remove, we tell people please enjoy those things about 1 week after surgery to make sure nothing gets stuck in the surgery areas.